Ashley Sellers, speech language pathologist and owner and operator of Speech Language and Beyond. I'm coming to you today to introduce the first video in our series on language that we are starting for the month of February 2020. If you want more background information of how a child should develop their first words and what it looks like when the development of those first words are delayed, please stay tuned. So first, let's begin by talking about what are first words. They are the first few words that children say between the ages of 10 to 18 months. And these words have to be words that are used with intentionality. So they're using these words to either label something or to make a request. And these are words that they're using consistently without us having to do anything to encourage them to use it. So for example, if they see ball, then they may look at it and say, ball, and they may point. That's their way of letting us know that they want it. Or if they see a familiar family member that they want, mama, dad, and they're using it intentionally to get your attention, that's what those first few words are. There are a few things that we need to look for leading up to the use of our first words. And the first thing for that is receptive language. That is how we process the information that we hear and then respond accordingly. The things that build on our ability to process information is our eye contact. So that's just them being able to look you in your face when you're speaking with them. And then joint attention, and that's you being able to hold on to their attention and hold on to their eye contact by as long as it is that you're looking at them, they're looking at you. If you're doing something to entertain them, you're not losing their attention. And then that joint attention turns into turn taking. So when you get into things like peekaboo and those types of games, the turn taking begins because they're either going to laugh or make some type of sound to indicate to you that they want that to happen again. That turns us into turn taking. And turn taking is a skill that we use all the time. I say something, you stop and listen, and then you give me a response, and then you say something back. And then motor imitation, this doesn't have anything right now to do with using your mouth to speak, but it's like once we start playing with toys with them and we're sitting on the floor and we bam a toy on the floor, are they able to do the same thing? If you get a car and you roll it across the room, can they push that car across the room the same way that you can? Imitating motor movements like this indicates that they are in the beginning stages of the muscles that are used for speaking. They're becoming more coordinated, that it could lead to the use of their first words. And then from there is the expressive language. Now this is just the use of words to express what we understand in our head. And let me just say this, children cannot give us what they don't have up here. So whatever they are hearing and processing, they need to be holding on to it so that they can give it back to us in words later on. All right, and so some of the things that lead to the use of first words for expressive language is them recognizing their caregiver's voice. This is important because these are the people that they are going to be able to learn words from and pick up words from. So they need to be able to recognize the voice of the persons or the people who are caring for them on a regular basis. And then from there, they're going to have what we call a differentiated cry. So before they can use words, babies are going to have cries that they use to indicate for us when they want something. So they may be a cry that they use for when they're hungry, a cry that they use when the diaper needs to be changed, or a cry that they give us when they're not feeling their best or they're not feeling well. Those cries eventually will develop into cooing sounds. Those are just those little sounds that babies make. They're not necessarily real words, but they're more like cooing and more comfort sounds, and eventually they take on a pitch or a tone, and then from there they go from open mouth sounds to babbling consonants and vowels put together, which is what I refer to as open syllables. So mama, dad, ba, different words like that. And then those words form into what we call our consonant vowel consonant words like ball or eat, words such as that, and they begin to imitate the things that they hear you say. All right, so let's keep going. All right, the next thing that we need to consider is when should first words occur? So from 6 to 9 months, we're going to have more of the babbling, like ba ba la la da 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 da. So they're going to babble that consonant and that vowel sound together, and it's going to sound like they're trying to attempt to talk in a sentence. And then from 9 to 12 months, we get the imitation of simple words like eat, go, no, stop. And then eventually they're going to go from saying words on their own where they're not having to imitate what you say, and they're going to put 1 to 2 words together to let you know when they want something. Mama, eat. Want, toy. Roll, ball. And they're doing this consistently as a way to communicate. So you can see that their use of those first words are building. And then also, from 12 to 18 months, then they should be to the point where they're using up to 20 words or more. They are going from combining maybe 1 to 2 words to maybe 2 to 3 words, and then it develops from there. Okay? Now, how can parents help? Number one, from day one, immediately after birth, you have to be very intentional with your interactions. One of the things that I see a lot when parents come into my office is that they assume that their babies are going to pick up off of the things that they say. Babies don't know to do that. You will have maybe 50% of them that if you don't do anything intentional, that they will be able to pick up on that. But my thing is, be intentional with your interactions from the beginning. So right when you start picking them up, whether you're breastfeeding or you are giving them the bottle or you're just having that skin to skin time, you need to be talking with them. You need to be making face-to-face contact with them. Always call your child by their name so they know who they are and who you are referring to when you talk to them. If you never call them by their name and you just talk at them, they're not going to know when that attention needs to be established when you are wanting to say something to them. So all these things need to start immediately after birth. Have your child track objects or sounds. So even when they're as young, I would say as 2 or 3 months, you can just clap your hands and see if they will turn their head because they heard a sound. You can blink the light on and off to see if they're going to look at it to see what's going on. And as they get closer to about 5 months, you may take those little teething keys or if they have some type of rattle toy that they're playing with, start it at center and then just see if they're able to track it. Those are some good things to do, and I would suggest starting this at about 5 months. And then as they get older and they're able to sit up on their own, or even if you're at the point where you can prop them up on something and they can hold themselves up, then you need to start establishing a play time or an interaction time with them. I would even recommend using like a high chair or one of those high booster seats that you have to attach to the chair, or you can just sit it on the floor. I remember like it was yesterday when I started this process with my son. So he had this football, and I think I have the video. If I can find it, I might put it in here. But we put him in his little, I guess, booster seat that could be strapped into a chair. I put it on the floor, and I would give him this football that he wanted, and he would just bang the football on the chair, and then that would allow for us to kind of have that one-on-one interaction. So I would bang it, he would bang it. I would throw something, he would throw something. We would do something with blocks or do something with a puzzle. You're just establishing some type of structured play with them, and it can even be unstructured if you're following their lead, but you're getting them used to sitting in front of you, looking at you, and you being able to go back and forth with them. Expose your child to different environments outside of the house. Let them ride in the car with you so they can see the trees, they can see other houses. Let them go into the store so they can see you shopping and you're labeling things as they go. You can start this immediately after birth. They need to be exposed to different environments, from going to the park to going out to eat to visiting a friend's house or a grandparent's house. All these different environments will help to stimulate their language and give them different ways to be able to communicate with you and with others. Always provide your child with a running dialogue of everything that is happening in their day. So from the time they get up, you're using good morning, hello, how are you? You're teaching a greeting. Then you're saying, okay, let's go and brush your teeth, turn on the water, let's wash your face. Those different types of things. Of course, now, when they're from birth, it is from infancy. These are things they can't do on their own. But even then, you still need to make sure that you're labeling everything that you do. Oh, you want cup? Here's your cup. Let's drink out of your cup. Oh, you want your ball? Here's your ball. Oh, you're rolling your ball. You're throwing your ball. Always giving them a running dialogue of what's going on as a way to stimulate their language. You should not have the expectation, especially from infancy, for them to be able to give that to you, give whatever you give out for them to give back to you immediately. You're going to do this from day one, immediately after birth, building on this skill every day so that you know that you're setting them up to be able to use language with you when it becomes necessary. And you don't always want to make it easy for them and put the desired things that they want within their view, or for them to be able to access it on their own. So, for example, if they have a favorite ball they like to play with, put it up on the shelf where they can't reach it, and it forces them to either make a noise or sound and come to get you for you to get it. It makes them have to ask for what they need by encouraging them to be able to use their words to do that. So those are a few things that parents can do to help. And I tell you all the time, I tell my parents all the time, you don't have to create this special thing that you have to do. All you need to do is just make sure that you're making time every day to spend with your baby on a regular basis. And no matter how minute it is, the activity that you're doing, you're just always telling them about what you have going on. Okay? So let's keep going. Okay, and what are some examples of those first few words? And so you, even if you want to help them with this as well, you can start using this hierarchy of sounds or words that you can start using to help build towards their first words. So start with animal sounds. Like I love to do those big block animal puzzles, and as they put them together, if they have a picture of a cow, oh, it says moo, and having them watch your mouth, moo, and see if they can say that sound back. Oh, here's a sheep, it says bah. Here's a duck, it says quack quack. Here's the cat, meow. Making those open mouth sounds through animal sounds as a way to stimulate the use of their first words. Environmental sounds like vroom vroom for the car, beep beep for the horn, or brr if you're cold and they need their jacket or they need their blanket, or ring 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 when the phone rings. Teaching different sounds such as that. And then also making sure that you're saying the names of people that are in their immediate environment. So dada, mama, papa, sissy, all those different words to identify the people that they are with on a regular basis. And then from there, it should go from that to common objects. So they should start to name objects that they see and they use every day. Apple, milk, shoe, spoon. Let me say this. I know when our kids are babies, we like to use baby talk because we think that is cute, but that is very much my pet peeve, because eat and shoo and ball are not real words. So just say eat. Just say ball. And sometimes we feel like we need to use that to make it easier for them. But if you notice, you're just saying the same word twice. So it could actually be making it harder. Just say eat, ball, spoon. Try to stay away from duplicating the word eat or ball or whatever. Just try to say the word once. And then from there, they should go from naming common objects that they see every day to everyday actions that they see. Eat, drink, walk, go, play. And what's going to happen once they begin to name objects that they see every day and they're able to say the names of actions that they see, if they put that together, that's going to create the first sentence. So eat apple, drink milk, go play. You can put those things together, okay? So what do we look for when we feel that a child's speech is delayed? So what we've done Previously is give you a setup for what the development of normal language or speech development, what it looks like. So these are the things that we need to look for when we suspect that our child's speech may be delayed. So are they giving you decreased eye contact or no eye contact at all? And this can even start from infancy. So it's like if you're looking at them, are they looking away from you? Are they not attempting to make any eye contact with you at all? Are they easily distracted by the things that are going on around them? Are they responding consistently to their name being called? If you keep calling your child's name and they don't stop to recognize that you're trying to get their attention, that is a key indicator that the joint attention skills will not be fully established, because at some point they have to stop to listen, to hear what is being said to them, for them to process it and to respond to it appropriately. So this is a very big sign, and the eye contact goes hand in hand. You need the eye contact to establish the attention, and it needs to be consistent. So if these two things aren't going on, especially by 12 months, that is a strong indicator, because through the eye contact and the joint attention, that's how they're processing what they're hearing, and they're being able to store it in their memory. If it's not stored up there because they're not hearing it or not processing it, then there's no way they can give it back to you verbally. Okay. Is the child very quiet as an infant with little to no vocal noises or sounds? So even from infancy, there should be some type of cooing, some type of babbling and vocal play. If your baby is very quiet, maybe between 1 and 2 months, there's nothing that you can really do about that, but I would definitely make a note of when you begin to recognize that, you know what, my baby is really quiet. They're not really saying anything. And then as you go into those different checkups, you allow the doctor to know that's what's going on. And even if they don't want to act on it right then and there, if you let them know that when your child is about 3 months old, and then you recognize that still is going on at 6 months, that makes a difference. So you just want to keep a note of that, because they should be giving us some type of vocal play from infancy till about 6 to 8 months old, before they really start using, some of those open vowel sounds. Is there a lack of gestures or vocalizations? This still leads back to the child being quiet. So even before they're using words, are we getting pointing or tapping or pulling and pushing behaviors if they aren't using words? That's what they should be doing if the words aren't there yet. And then they should get to the point where they're pairing those gestures with vocalizations like uh, uh. They should be making some type of noise to point or to let you know that they want something. This leads back to the child just being abnormally quiet and not saying much of anything at all. And you will find that sometimes you have children that have very strong receptive language, that they can understand everything that's being said to them. They can follow any command that you give. They can point pictures out in a book, but they are just determined that they won't say anything. There are some underlying things that could happen there. Either they are in the process of developing some type of articulation disorder. They wouldn't know it, but maybe when they try to attempt to use words, it's not coming out the way they want it to, so they don't say anything. But you can have a child that has very strong receptive language skills, but still aren't to the point where they feel it necessary to use any words. Are there decreased imitation of or use of motor movement? So are those motor speech, those motor skills delayed? Are they sitting up? Have they not set up yet at the right time? Are they not picking up things appropriately or able to handle things on their own? If they're not being able to roll a ball, picking up a spoon, rolling a car back and forth, and they're having a hard time imitating that, then that could also be an indicator that those speech skills are also going to be delayed as well. And then if they are using little to no words at all by 12 months, these are indicators that your child may have delayed speech, and at this time you need to make sure that you're talking to their primary care physician or their pediatrician to see if you can get them in some form of early intervention or get them started with some early speech therapy services. Okay, so That is pretty much all that I've had for you guys. I did the best I could to try to keep this video as short as possible, but I still wanted to make sure that I gave you the most detailed information possible. So this month in February, we are doing everything that you want to know about language, and I feel like it may extend beyond the month of February, but in the time being, we are going to have a 50% off sale on our language workbooks in our Etsy shop at Speech, Language, and Beyond. And for this week, the first week in February, we're going to feature our baby's first words. This is one of my first workbooks I've ever developed. It's one of my best-selling ones. I encourage you to use it, and I do think that you will find it resourceful. Thank you for watching, share, and subscribe, and I'll see you all in the next video. Bye-bye.